Oh, Kwame, it's been good. It's been good. Yeah.
Really good to see you.
Yeah, it's good to be here.
So we've been talking about organs for the past couple of weeks.
Mm-hmm.
And today we shift our attention to the kidney.
Right.
We're going to talk about the chronic kidney diseases, isn't it?
Yes. That's exactly what we're going to do. And good afternoon to all our listeners. And it's good to be here once again. And Kwame, as you rightly said, we've been focusing on the two major organs, or we promised we would focus on the two major organs. And we've done the liver already. We had a series on the liver. And now we're going to turn our attention to the kidney. If we have time, we'll talk a bit more. So today, we're just going to have a bird's eye view. I'm going to talk about chronic kidney disease.
Okay.
And just give a bird's eye view of what chronic kidney disease is. Unfortunately, sometimes I don't know whether to say we're seeing more, but it's become a much more visible disease entity. You'd realize that somebody says, oh, I know this person who has kidney disease. I know this person who's suffering and needs dialysis. You hear it a lot. And yes, we also keep seeing a number of people coming to the hospital with it.
Isn't it only creeping in recent times? Because back in the day, you hardly hear it.
Yeah, so I don't know whether it is more of the publicity being given to it these days, or whether or not we are seeing increasing numbers. Because if you work in the tertiary institutions, Kolebu, Konfanoche, for example, then they've had their renal medicine unit or the dialysis unit for years now. You know, now you're having the dialysis centers popping up in other institutions as well. So maybe it's a question of more. And I think by the time we finish the conversation, people will be able to settle this one way or the other. So, Kwame, what is chronic kidney disease? In simple terms, it's a condition characterized by the gradual loss of kidney function over time. So there's a gradual loss of the various functions of the kidney over time. The kidneys are located in the abdomen. So we're going back to our anatomy class, which Kwame didn't pay attention to.
No, I remember I remember the liver is on the right upper, just below the rib.
True or false? True.
Yeah, true. So if this one is in the abdomen, it means it is lower than the liver.
Charlie, what been, Papa?
Oh, you know how we do. That's not a mask. Even if I went to say that, like I'll finish that. Which schools were doing? Like I'll finish them.
Right. So we've all got a pair of kidneys. Usually, might say there have been some rare instances where people are born with just one.
Really?
Yes, but usually you have a pair of kidneys, and they are located in the abdomen, more of the posterior side of the lower abdomen. They have a number of different functions, but broadly, we'll put them into three main categories. The kidneys have what we call excretory function, meaning they remove substances that we don't need or waste substances out of our bodies. One of the things I always tell people the kidney does is to take away excess water. Can you imagine all the water you've drunk since you were a child? If it was all kept in you,
come my ship,
swimming pool, Olympic size swimming pool, you know. So excretion, so just water, getting excess water and maintaining the right water balance. So that's one of the excretory functions. There are a lot of waste products that it also excretes through the urine. It also has what we call a synthetic function. It produces, so it's a productive function. It produces some very important chemicals. We call them EPO. So next time Gary comes into the studio, he comes to read the news. I want to shock him, test him small, ask him about EPO. Gary would know.
Really?
Because he's a sportsman. He tells you that he's a doping agent. So EPO is a very important chemical substance that's produced by your kidneys, and it stimulates your bone marrow to produce blood.
Hey.
It's very important. We should take note. It will show up again sometime in the discussion. So the kidneys are important for blood production or formation. So that's what we mean by the synthetic function.
Synthetic function.
That's one example. It produces EPO. Then you have what we call the metabolic function. All right, where things like calcium metabolism and vitamin D also metabolism, so that you get enough calcium getting into your bones, strong bones, and all of that. So these are the three broad functions of the kidney: excretory function, production or synthetic function, and then you've got the metabolic functions. Now, Kwame, let me share with our listeners some facts about the kidney. 37 million American adults have chronic kidney disease. And if you look at their population size, and you have 37 million of them adults having or suffering chronic kidney disease, that's a big, terrible number. It was difficult to come across what the global picture, looked like, and statistics in Ghana was a bit difficult to get hold of. But I'm sure the dialysis unit or the renal medicine unit in Korebu would have their own small set of numbers. Heart disease is a major cause of death for all people who suffer from chronic kidney disease. So most people who end up with chronic kidney disease do have heart problems. Again, we'll come to that in a bit. Hypertension is one of the causes of chronic kidney disease, and chronic kidney disease also causes hypertension. So you end up in this vicious cycle where this causes that. CKD causes hypertension, hypertension then causes CKD, and then that becomes a very terrible thing. High risk groups include those who suffer from diabetes, high blood pressure, and then those who have a family history of kidney failure. So these are high risk individuals as well. Then again, Africans and people of African origin, in terms of ethnicity or race, we seem to be at a greater risk compared to, say, Caucasians, Orient people from the Far East, Hispanics, and so on and so forth. That is what causes CKD, chronic kidney disease. What causes CKD? There are two main causes of chronic kidney disease in Ghana and then globally: high blood pressure, uncontrolled; diabetes, uncontrolled. Yes. These are the two biggest causes of chronic kidney disease. These are the two medical conditions that cause a gradual loss of kidney function over time.
Okay.
So if you go to most renal medicine units or kidney disease centers, it's always 1 and 2: high blood pressure and then diabetes. Most of the patients have this kind of history. And actually globally, it is stated that it is responsible for 2/3. These two conditions are responsible for 2/3, up to 2/3 of all cases. So it's a very, very significant amount. High blood pressure or hypertension, can cause a lot of different things in your body. It puts a lot more pressure, and then it damages almost every organ. But the kidney is one of its primary targets, and it does that silently. And that's one of the dangers in talking about hypertension to people, that it's difficult for them to perceive. Because if your blood pressure reading is beyond what it's supposed to be today as you're listening to this show, you probably wouldn't know your kidney is taking a hit. It just doesn't show anything in the initial stages. So then it makes it difficult for people. Unlike, say, you have malaria, you're going to have a headache, a terrible headache. You've got a fever, chills, loss of appetite. You probably are vomiting, and therefore you'd want to go to the hospital or go and see the community pharmacist and then get something. But if your blood pressure is very high today, beyond the recommended limits, then you probably wouldn't feel anything going on with your kidneys, and it gives you a false sense of everything is fine. But then gradually it is causing damage to the functional units of your kidney, and over time then it begins to show up. Of course, there are other conditions of the that cause chronic kidney disease. You can have something we call this one is a big word, glomerulonephritis. Glomerulonephritis. These are a group of diseases that cause a lot of inflammation, that is pain and swelling in the kidney, in the substance of the kidney, and damage the kidney's filtering units. So the kidney is a filter. It's a big filter. It filters the blood and then gets some products out and keeps some of it, the good ones, too, in the blood. So the kidney is a filter. So if you have this condition we call the glomerulonephritis, again, it's an umbrella term, and there are different types or individual diseases under that umbrella term. Then you damage your filtering units in the kidney, and then eventually you may develop chronic kidney disease. Then there are also some inherited medical conditions. There's something we call polycystic kidney disease, where you have little balloons forming in the substance of the kidney. These are cysts.
Wow.
That's how I would describe the cysts, as little balloons. And then they may also destroy it. Then you can also have some malformations. You are born and your kidney didn't quite form really well. There are a lot of genetic codes and messaging molecules that are sent throughout the body during the formation process. And sometimes you can have some malformations as the baby develops in the mother's womb. Then you can also have things like kidney stones. I'm sure you've heard about kidney stones.
I have.
Right. So kidney stones can, depending on their location, and if they are not dislodged or removed, then they can lead to an obstruction, because then the urine can't flow. So if they are large enough and they are located in a place where it cannot be dislocated or dislodged or removed, and it goes on for a long time, then it can cause a problem. Sometimes you can also have cancer, tumors, growing in the substance of the kidney that can also lead to obstruction and also cause chronic kidney disease. An enlarged prostate in men over a long period of time can also lead to chronic kidney disease. So these are the other conditions. But Kwame, I want us to focus on those two conditions that form 2/3 of all of the cases: high blood pressure and diabetes.
Yeah.
Remember, with the diabetes, we are talking about, we have type 1 diabetes and type 2 diabetes. So both of them, whether you have type 1 diabetes or type 2 diabetes, if it is not properly controlled, then your kidneys are going to take a hit. You're going to develop a condition we call diabetic nephropathy. And then you develop your chronic kidney disease, meaning you are losing the various functions of the kidney over time. So diabetes and high blood pressure are all treatable conditions. But we're having a big challenge on our hands as physicians in getting people to accept, one, that this disease is something that lives with you, or you're going to have to learn to live with. So that's something that I find a lot of my patients having a difficulty to mentally accepting. And also we're getting too much information, or misinformation, I should say, in the news, in trotros, in buses, all over the place. So-called churches, I'll call them so-called churches because the mainstream or the good churches don't do that. Where people actually discourage those who suffer from high blood pressure from regularly taking their medicines. And when it comes to high blood pressure, then the men in particular, because there's this thing that goes around a lot that, if you take high blood pressure medicines, then the gun won't fire well. Doesn't fire. Too. Well, if you have chronic kidney disease, well, then it's not. You are not even going to sell the gun to you for somebody to come and take it again. You're just not going to be in a good state of health. So let us remind ourselves: your blood pressure as an adult. We have very simple guidelines. Most of the time, it's a silent disease. So until a cuff is placed on your arm and a reading taken, nobody is able to look at an individual and say, you know what, you have high blood pressure. And that's why the checks are important. Unfortunately, I've seen sometimes, this time I went to Medina Market following the missus around. There are people holding, these blood pressure monitors, and they're checking people's BPs. Are they physicians? Are they healthcare professionals, trained nurses, to be able to interpret the number that comes up? And I see a lot of people doing that. People are going around businesses, corporate institutions, and saying they are checking and all of that. So there's a bit of danger in there. The guidelines are very, very simple. I'm not going to put that out on air, but the guidelines are very simple, and you should get a healthcare professional, a nurse, a doctor, a physician assistant, a healthcare professional who knows to put the cuff on your arm, a calibrated equipment. Somebody's been using their blood pressure equipment for 5 years. They've never calibrated it. It's a measuring device. So sometimes the calibration goes off and it gives you faulty readings. It's not just changing the battery. So you've got to do that. When it comes to diabetes, most of the time or in the early stages, it doesn't also give you symptoms. It only gives you symptoms when it's far advanced. So again, just a simple point of care device. We take a blood sample, and then we're able to measure the glucose level and then make a determination. Then your doctors will roll out the care plan for you. So these two conditions, we've got so many things in our arsenal to deal with them. But compliance is a big problem. Accepting the diagnosis is a big problem. And generally, people think we make too much fuss about it because they feel okay until suddenly it hits, and then they begin to experience the symptoms of CKD.
And what are those symptoms?
Right. So, in the initial stages, you see, your kidneys are very robust, just like the liver. So in the early stages, when you lose function, you are probably not going to see much. So there's a way we measure function of the kidneys. We call it the filtration rate. All right. So we take a blood sample and then we do a simple test on it. So in the initial stages, you may not notice anything, but as the loss of function progresses, one, you begin to feel more tired and have less energy. And for me, a lot of my patients who come to me who have diabetes, hypertension, that's how they come to me. Doctor, I don't feel too well, but you see, I can't put my finger on it. I don't really know what's wrong with me. I can't put my finger on it. But I know my body. I know I'm not fine. Okay, but tell me, you're not fine, so tell me, doctor, I mean, but you're fine. That is what this thing means. You feel more tired and have less energy. Number two, you may have trouble concentrating. Again, these are not very specific symptoms for kidney disease. It can happen with different medical conditions. Three, you may have a poor appetite. So I always make fun of those who say you booty and all of that. They just go and take some appetite. No, look, if you lose your appetite, don't just go and take some quarter somewhere or a tot glass and just down some appetite or some spirit. It may be that something is really wrong with you. So the loss of appetite, having trouble sleeping may also be a symptom. Having muscle cramps at night, yes, may also be a problem. Sometimes people begin to accumulate certain waste products that need to come out of your body. So then you have what people call a muscle pool. Also, if you keep having that all the time, yet you are not doing things that would accumulate lactic acid in your muscles, but yet you are having those cramping pain in the big muscle groups, then you may want to think about it. Swollen feet and ankles, facial puffiness or swelling around your eyes, especially in the morning. When we all wake up in the morning, I think our face look like somebody who's been sleeping. But then we're talking about periorbital puffiness. You are very puffy around your eyes, very puffy. And it typically tends to resolve by mid-morning. So by 10 o'clock or something, then they're coming to the hospital and they say, oh, doctor, when I was leaving the house, my eyes were really, really puffy. But I get here and then it seems to have resolved. So early morning facial puffiness, which resolves mid-morning in the initial stages, may also be a sign or a symptom. Having dry, itchy skin may also be an indication. And then the need to urinate more often, especially at night.
Okay.
So it's just a combination of all of these things.
Yeah.
These things are alerts that go and see your doctor, go and see your physician, go to the hospital, and at least report and be checked.
Okay. Let me activate the phone line so that we can pick a couple more questions. Richard in Cape Coast sent in one, so I'll read that to you shortly. But I can call 0302216541 or send us a WhatsApp message on 055-1111-997 if you have any question in regards to the chronic kidney disease. Richard in Cape Coast says, Lexis, kindly ask doctor where I can get my kidney checked or diagnosed and whether it is covered by the NHIA policy. Right.
So any hospital, there are different extents to which we can investigate the kidney function. All right. So it always starts with a history. So I'd always say, look, you can go to any facility. The healthcare professional will sit you down, the doctor will sit you down, and then take a very good history. If you have diabetes and if you have you suffer from high blood pressure, then you are an at-risk group. If you have a family history of kidney disease or kidney failure, you are an at-risk group. People of African origin, us, we are an at-risk group. So I'd say go to any health facility,
and get it
and then we will start with a history and then a basic blood test would be a first start where we do the kidney function test, and then based on that, probably the doctor will ask for other more sophisticated tests.
Nana?
Yeah, Lexis, I'll be.
Very well. Go ahead. Let's hear you.
Regarding I heard something about yeast, where some small bubble on the kidneys. Can you explain that further, and what might be the causes of it?
Right. So, Nana, I think I mentioned that when I was trying to explain polycystic kidney disease. So, the polycystic kidney diseases it's an example of an inherited disease condition, or if you like, it's a genetic condition, and that's passed on where you develop little cysts or a lot of cysts, multiple cysts within the kidney. And I was just trying to explain what a cyst is. It looks like little balloons filled with fluid that show up in the substance of your kidney, and it can damage your kidneys.
Yvonne.
Hello.
Is it Yvonne?
No, Nana. So Nana.
Nana. Yeah,
okay.
Nana.
With the yeast, is there a way that you can resolve it, or there's nothing that can be done?
Oh, well, there is something that can be done. Depends on the extent to which the cysts have taken over the kidney. So we need to sort of like, the doctor needs to see it. A nephrologist, you'll probably be asked to see a kidney specialist, and then you would have a conversation from then on.
Yvonne.
Yeah, hello.
Welcome, Yvonne.
Hello, Lexis.
Let's hear you.
How do you cure kidney stone? Or what are the symptoms of kidney stone?
Right. So I did mention kidney stones as one of the causes of a certain type of or leading to chronic kidney disease. It's usually an obstruction. It causes an obstruction. So the cardinal sign of kidney stone is excruciating pain. Excruciating pain. So you can have silent stones, and sometimes people pass these stones, very small size stones. So if you urinate in, say, a metal bucket, for example, then you would hear a chink in the bucket as you urinate, and then it could be that you have passed the stone.
Wow.
Right. So smaller stones may be painless, especially depending on their location. But anybody who's experienced kidney stones before, and my big brother has, and you'll find men, grown-up men, on their knees crying, thrashing about. The pain is excruciating. So the pain is a major thing that brings it to attention, and the pain is experienced in the region of the kidney, because that's where most of the time it is. So the kidney is in the flank region towards your back. So where sometimes people are putting their hands on their waist, where your hand tend to go, or where your thumb would be if you put your hand on your waist. That's where people tend to experience the pain. So that's the cardinal feature or sign that brings it to attention.
Kweku says I have a BP of 1.
And it can be dealt with. Yes, I think she asked whether or not. Yes,
yeah.
Kidney stones can be dealt with. There are different modalities of treatment.
Kweku says I have a BP of 130 over 195. For the past 3 months, I'm 48 years. I have a headache on the left part of my head. I've been given
Nifedipine.
Okay.
Yes.
Is there a way I can go without the medicine?
Well, the blood pressure reading is not optimal. What he has put out there is not optimal.
What does that mean?
It's not good enough. It's still high.
Okay.
100 is still high. So his blood pressure control is not good enough, even though he's been put on nifedipine. We don't know that you can go off antihypertensive medication. For now, that is the state of the knowledge. In future that can change. But even with this blood pressure reading that he's put out there, Kweku, I'd say you need to talk to your doctor once again, because that's one of the dangers. People get put on medicines, and there's supposed to be a target blood pressure reading, which is optimal, where we want it to be.
Okay.
So it's not just being on the medication. Say, oh, okay, I've been put on medication for a month or two, so it's fine, let me stop. So we don't stop. It's your doctor that would determine even the dose, the strength of the nifedipine or the particular medication.
And I'm sure there are other lifestyle changes as well that could help.
Exactly. So it's a whole lifestyle, what we call the TLC, the therapeutic lifestyle change. So we roll out the whole care plan, and it's not just the medicine. We talk about the diet, we talk about exercise, and so at the appropriate time.
So do we have to have a part 2 of this conversation?
Right, we'll talk about other kidney diseases. I mean, this was chronic kidney disease, but then there are other specific things. People were talking about kidney stones, so maybe we want to talk about kidney stones. I mentioned the prostate and how it affects the kidney, for example. So maybe we can talk about.
Let's do that next week when you're here.
Right.
Is that fine?
That's fine.
For those who want to call you and ask more questions, how can they reach you?
Yeah, I think there are a lot more questions that we haven't answered just because of time. So, number is 0501 477 340. 0501 477 340.
All right. Dr. Yaw Osafo is the CEO of Medical Hospital. You can speak to him if you have more questions or you have anything you'd want him to